Our literature review focused on the effects of adverse childhood experiences on substance use and mental health outcomes in the adolescent population. Our PICO question was, in adolescents who abuse substances and have experienced adverse childhood experiences, what is the effect of cognitive behavioral therapy compared to no therapeutic intervention on the rates of mental health disorders over 1 year? Brittany focused on abuse, Erin focused on neglect, and my focus area included household challenges, which can include things like homelessness, housing insecurity, parental separation, and family history of suicide. Overall, there was a large gap in the research when it came to the effects of household challenges on the adolescent population in relation to substance use and mental health. There were not many studies completed that focused on specific treatments for this particular population, and instead most studies focused on prevention interventions. These interventions were typically classroom-based, which homeless students may have been unable to access. The studies that I found during my search involved findings that included, as the cumulative number of ACEs increased, suicide ideation and attempts in adulthood also increased. CBT is an effective intervention for homeless youth to improve depression and substance use. Among street youth in Egypt, ACEs are a primary risk factor for substance use disorders and addiction, and adolescents with high levels of exposure to ACEs, including homelessness, had greater rates of depression. This research is important to nursing in terms of developing new health policies, such as mandatory incorporation of ACEs assessments. Community health nurses could be especially helpful in future research and the implementation of prevention and treatment interventions for the specific population, because they are more likely to be working in the community with this population.
As previously mentioned, ACEs can be broken down into 3 different categories: abuse, neglect, and household challenges. The aspect of ACEs that I chose to focus on was childhood neglect. After conducting a search that included terms like childhood neglect, emotional neglect, and parental neglect, I was able to sift through the results and find 5 relevant, high-quality articles that pertain to our PICO question, as well as my personal focus area. A thorough critique was done for each of the 5 articles, and afterwards the findings could be synthesized to discover overlapping information. Overall, the results are mostly in agreement that neglect during childhood leads to higher risk of substance dependence later in life during adolescence. Therefore, there was a positive correlation between ACEs and onset of substance use during adolescence. Interestingly, one of the articles discusses the concept of impulsivity, meaning that child abuse and neglect was associated with increased impulsive behaviors in middle to late adolescence, which significantly predicted substance use in these individuals. Between the 2 intervention studies, CBT and family psychotherapy showed decreased rates of emotional and mental health symptoms, and therefore the findings are congruent on the effectiveness of CBT intervention for this population. CBT should be implemented into after-school programs and other support groups to help these adolescents. More research should be conducted on child neglect alone and not ACEs in general, as there was limited research that focuses solely on neglect. Much of the results pertain to several parts of our PICO question, but not all parts. This displays more gaps in the research that should be addressed going forward.
My chosen area of interest for this integrative review was child sexual abuse. While thoroughly searching for studies to answer our PICO question, I found a significant link between adverse childhood experiences, substance use, and mental health consequences such as depression, post-traumatic stress disorder, and suicide ideation and attempt. Adverse childhood experiences, specifically child sexual abuse, is a primary risk factor for substance use and depression. Commonly, victims of child sexual abuse use substances to cope. While this integrative review was mainly centered around adolescents, research has shown that the effect of adverse childhood experiences has carried into adulthood. Cognitive behavioral therapy is shown to be an effective intervention in improving mental health consequences in child sexual abuse victims. However, there were minor improvements in substance use. Therefore, more research needs to be completed to determine the effectiveness of cognitive behavioral therapy in reducing substance use. Prior research notes that there is a possible relapse of symptoms after the conclusion of therapy, and therefore reassessment should occur in intervals to ensure a relapse does not occur. A major gap that I noticed in the literature was that the studies primarily focused on the treatment of the issue rather than prevention. With that being said, nurses can play a key role in applying primary prevention through detailed assessment and screening to determine if lingering effects of trauma are present.